I have 15 more funding deals to talk to you about. And I have already spoken to you on Health in 2.0 twice this week. I think the last time we did 3 Health in 2.0s in 1 week, it was alcohol fueled and at HIMSS 2019. Now we actually have some work to do. It's the July 17th episode, the third this week of Health in 2.0.
Jessica, what is going on here?
Oh my God, I can't believe it.
Look, you said we have 16 deals that we haven't covered already this week.
Yeah, and we've done
have to
2
go
other
really,
episodes.
really fast, don't I?
Things are going nuts. Like, I can't. Have you ever seen it like this? Health tech?
No, I mean, I don't think so, because we got some big deals this week. We got some startups. We were told by the cognoscenti in venture capital that we talked to when the recession first hit 3 months ago, that it was all going to be very quiet. There was only going to be like keeping their current portfolio in business, and instead everyone is writing checks like drunken sailors, and the public markets are going crazy too. And yet the recession goes on, and the healthcare system seems to be losing money. So I don't understand it, but it's certainly keeping us very, very busy.
Oh my God, so busy. I miss those days of the good old HIMSS happy hour Health in 2.0s when we really weren't working.
It's quite clear they've just decided the schools here aren't going to go back. It's quite clear there's going to be no conferences this year and probably not next year, and we're never going to get a free drink again.
I know. Somebody should send us something for our trouble.
Please, if you're watching this, please send me and Jessica more free drinks, because we're worried about becoming sober people.
I guess so.
All right.
Are you ready to do this?
Let's do as many as we can.
Get your timer. Here we go. We had some good ones. Well, not that they're not all good, but here we go.
Okay.
All right. City Block gets 54 million in a B. Lots of their original investors are in this, including, and then Alphabet is new on this one.
Yeah, well, Alphabet, I mean, they were spun out of Google originally, so Alphabet's the logical one to come in. City Block is another primary care deal. This one is looking for Medicaid and dual eligible, difficult to reach, difficult to manage populations. Really interesting organizations. I've said before about them. Really cool organization, but I wouldn't necessarily move to New York City to become very poor to become a member, but love what they're doing. And it's another primary care one, which is what, the 6th this week?
Ton. And here's another trend that we've noticed this week. Virtual pharmacies with prescription delivery, 2 of them get funding now. Medley gets 100 million in a B round, and NowRx crowdsources their $20 million round. What's going on?
They say they capped it at 20 million because they could have raised a bunch more. I mean, look, and we've had a whole bunch of them going on, and then not so long ago, SoftBank put money into the one in San Francisco's name I've forgotten. Yeah, I mean, clearly the delivery back end of pharmacy is going to change a dramatic amount. There's a lot going in here, and some of the big incumbents, especially Walgreens, having real trouble. So we'll see what happens.
All right, care coordination stuff. There's this mega merger with 3 different health tech startups, Curavi, Carepointe, and U.S. Health Systems, that's now being called Arkos Health. And at the same time, another startup you said, Noteworth, gets 5 million. What is happening in this care coordination space here?
So this is all about managing people remotely using both those Medicare remote monitoring codes, but also putting together a better idea of how do you manage people who are sick under cavitation or under value-based care, and getting to those nursing homes increased the pace by COVID, because you've got to get to these people without touching them. So that's basically a broad amount going on here.
All right, cool new CGM emerges. Movano announces a $10 million raise, comes out of stealth mode, and they've got this cool watch that it lets you read your blood glucose without pricking yourself. It uses radio waves.
I know, because I remember at some alcohol-fueled party when we were all testing the I think it was the Abbott CGM, or was it the I can't remember, was that one of the Dexcom that somebody didn't like their CGM very much, and you should have got this one instead.
I know, it didn't stick in my arm well.
Okay, but the big point about what's going on here, Jess, is that we're seeing a move. Right? So you've got Dexcom and Abbott, the market leaders here with their CGMs, which stick in your arm. obviously we've had a lot of discussions about Apple getting into this business, and maybe this new company is going to, with its 27 million, is going to get ahead of them. The idea is, what can you do to make it as pain-free and simple as possible for people with diabetes to manage their blood glucose? And don't forget, you've got our friends at Livongo, you've got the new entry from United.
OneDrop bought that technology too.
OneDrop's got some technology. This is one. A whole bunch of people are trying to figure out, how do you get away from the strips, right? Because the business of diabetes has been selling the strips, and people are loath to prick their finger. What can you do about it? So you're going to see a ton more here. Apple and Samsung are kicking on this area as well. I would expect that it would be, push this out 5 years. It will be very unusual, I think, for a person with diabetes not to be wearing that kind of a watch and be constantly monitored by some kind of coaching facility, whether it's United, Livongo, Kaiser, somebody we haven't talked to yet. So I think that this is the focus of this market is going to continue to go, and it'll not just stop with diabetes and blood glucose monitoring. You're going to have blood pressure in there, for hypertension, other kinds of heart rhythm stuff. The focus on surveillance is going to just continue to increase, and this is going to look very, very different in 5 to 10 years than it does now.
What is this that Glenn Tolman coined it? The consumer-directed virtual care? Is this all of that stuff?
I think it's closer to what you coined, the continuous clinic.
Continuous clinic.
I mean, I don't know about how consumer-directed this is. I think that's mostly BS. I think the answer is people who are relatively sick are going to need a lot of care and attention, and you're going to have to bring in a whole mix of telehealth, physical care, virtual care, and remote monitoring. And, that's kind of what, if you look at what that No Worth company is doing, that's what they're kind of doing as part of this. They've got an underlying platform for that. Current are doing that. A ton of other companies I'm seeing optimize. We had Optimize.me on here. And, there are a gazillion companies thinking about trying to get into that. And obviously, the bigger players who've got tentacles out there now, whether it's these primary care groups that we've been featuring this week, or whether it's the Livongos and Armadas and United Health Groups and others who are trying to get into coaching in the home. This platform, you can just see the component parts being built. Like I said, I think I like this term continuous clinic, mostly because you made it up. Although because you didn't like my term plicimo.
No, because that makes no sense.
Patient location, patient location independent care integration management organization. You didn't like it?
No, you sounded like that little Martian from the Warner Brothers cartoons that had that P-42 3000 laser to blow up the earth. It was just too complicated.
Too complicated, right?
Continuous clinic. See how simple that is?
but that is kind of where we're heading. Obviously, the question is, can we get the payment system to reflect that? But you can see the technology is now being put into place because, it's exactly what Indu and I have been talking about for all these years. It's flipping the stack, making a technology layer underneath it. You can start layering healthcare services about. And as we now all got the technology layer, all the technology is getting better. I mean, you can just see this is not going away anytime soon. How it actually gets folded into the day-to-day delivery of medical care is to battle for the next few years. But I think didn't Hemant Taneja and Steve Klasko just write a book about it? Yes, we'll have to get them on the show and figure out what they think the answer is. And then you and I better write the book about the continuous clinic pretty damn quick, or else we'll be too late.
we should definitely do that. What we didn't even get to is the most exciting news for me today. Walgreens partnering with DoorDash to deliver non-prescription stuff to my home. I just wanted this last week, and now here it is. Thank you, Walgreens.
You were lying, and couldn't Instacart have done that already? Or
no.
Postmates got bought by Uber. I mean, this home delivery thing. Everyone is losing $1 gazillion in this, but there you are wanting to pay a delivery fee to get your meds plus your candy plus whatever your NyQuil from Walgreens.
I live alone. I'm sick. I don't want to schlep myself to the pharmacy. Bring it to me. Love it.
I understand that if you are really sick, there's a company called Eve that will bring stuff to your home that's just as good.
Hey now. That's a whole different kind of healthcare, right?
I just ordered some CBD from Tommy Chong because it sounded really good, and I wanted to support him for the time he spent in jail. So.
Okay, well, CBD does not have any type of hallucinogenic properties.
What? What am I then? Oh, God, now you tell me. You
wanted THC. Okay, enough of this. I'm cutting you off because we could go on. And there are so many more deals to discuss. You're probably
never got to.
I know.
Perhaps we can have a moratorium on deals next week and catch up with the rest of this week's and last week's next week.
No.
It's just going to keep going? Oh, well.
Keep throwing the cash around. I'm here to catch it.
Okay. Well, not enough being thrown in our direction, but I'm sure you can figure that out.
maybe eventually it will. Trickle down effect. All right.
Trickle down Reaganomics. Trump.
Yes, exactly. I'm going to Reaganomics this right now. So if you want to trickle down some of your newfound wealth, health tech startup companies, why not advertise on the healthcare blog or throw some money at me and Mr. Holt? Follow us on Twitter. He's at BoltyBoy. I'm at Jess Damasa. And of course, you can go to thehealthcareblog.com and download our prospectus for all of the various advertising, marketing, and PR opportunities that you too can buy now because everybody's getting funded but us. All right. On that note, we're done. See you guys soon. Take care.